My name is Emily, and I'm really excited to be celebrating Women's History Month and the contribution that women make in science and medicine, as patients, and especially as blood donors. It's wonderful whenever you go into a Vitalant. It's a very diverse workforce, right? And the women there, I'm always inspired to see the nurses and phlebotomists taking blood and how passionate they are for what they do. And whenever I have a woman nurse, and I always share my story whenever I'm giving blood, it's amazing how many times they say, oh, that happened to me, or that happened to my sister, or that happened to my mom. And it becomes like this really emotional moment where so many of us know people who've been harmed in childbirth, and this is something that we all just wish we didn't have those stories to share, right? 4 years ago, I went into the hospital to have my daughter Lucy, thinking everything was going to be totally fine, and I ended up in the ICU the next day, having pretty much died and been saved by blood donors. So I suffered an amniotic fluid embolism, which is rare maternal complication, unfortunately not as rare as it probably should be, which led to postpartum hemorrhaging. I lost all the blood in my body about 9 times over in the course of just a few hours. In 2019, I wrote a book called Procedure: Women Remaking Medicine, and it's about the different stories of women who are nurses and physicians and scientists and policy experts, all working to try to create a more humane, safer, more affordable healthcare system for us all. Women are such an important part of the healthcare system. I mean, we're most of the patients. Most of us, if we have kids, that's a big introduction to what it's like to be in the hospital, to be a patient, to interact with nurses and doctors. And we're also just an incredibly important part of the healthcare workforce, right? With all the nurses and doctors and researchers and people who are women all across our entire healthcare system. I really love, I think, the personal experience that many women bring to the healthcare system, either as people who've had their own children and been patients through that experience, who've served as caretakers for children or for aging parents. Women have a really unique perspective, I think, on the healthcare system and what we want it to be like, which is more caring and more effective and safe and affordable for everybody. I think the biggest takeaway from writing Procedure was just to see how powerful women are as leaders in a way that we don't always recognize in ourselves. There's a lot of different ways to be a change maker in healthcare. That doesn't mean that you have to run for office or become the top physician in your hospital. There's a lot of ways that just any individual can create change and just make one small step that helps the healthcare system be a little bit better. I mean, the history of women in medicine in this country is incredibly young. Even up until the 1970s, most medical schools had quotas that they would only allow in a certain number of women women medical students into their ranks, right? So a lot of medical schools, it was 7% or 10% could be women. And those women who survived through that medical education are doctors today, right? And they're part of a new wave where just now, I think last year was the first year that women and men were equal going into medical school, especially as women who are the primary users of our healthcare system and are also the primary workforce in our healthcare system. What I'm trying to do is help raise everyone's voices and say, together we can actually advocate for a huge amount of change. Like, let's work together to make it safer for women to have babies, to recover from childbirth, to have support around having kids and fertility. And there's just so much that we could be doing to have a healthier entire American population by focusing first on the women.